Hi, everyone, this is the Encyclopedia channel. Have you noticed that some people have difficulty falling asleep? Sometimes they can sleep, but wake up after an hour or two, and it is difficult to fall asleep after waking up. There are also those who stay up all night, restless, unable to control the fear of not having a clear object or content, or the painful experience of fear. Some people show depression as the main symptom: depression, sadness, low self-esteem, and a significant decrease or even loss of interest in daily activities. Some people are suspicious and always suspect that others are talking bad about them. They are very worried that it is bad for their health, but they cannot control themselves. This is actually the performance of depression. So what is depression? Why does it cause depression? How to treat and prevent depression? After watching this video, you can get the answer. Depression is a common mental health problem that seriously affects the quality of life and well-being of millions of people worldwide. Symptoms of depression vary widely, and depression is not a brief bout of low mood, but rather a persistent, severe emotional disturbance manifested by persistent feelings of sadness, loss of interest in and enjoyment of life, fatigue and low energy, sleep problems, insomnia or hypersomnia, changes in appetite, decreased concentration and decision-making skills, feelings of low self-esteem and guilt, and suicidal thoughts. These symptoms can lead to difficulties in daily life, affect the individual's emotional, cognitive, behavioral, and physical health, and affect their work, school, and interpersonal relationships. Diagnosing depression requires a comprehensive evaluation by a professional physician. The doctor will assess the severity, duration, and impact on the individual's daily functioning of symptoms. Commonly used diagnostic tools include clinical interviews, symptom questionnaires, and psychological assessment scales. Among them, the Patient Health Questionnaire 9 and the Hamilton Depression Scale are commonly used assessment tools for assessing the severity and type of depression. Depression is not limited to a particular age, gender, or socioeconomic background, and it can affect anyone. It may be caused by a complex interaction of multiple factors, including biological, psychosocial, and environmental. Biological factors. Genetic factors play an important role in the development of depression. Research has found that family history is one of the most important risk factors for depression. In addition, the imbalance of neurochemical substances is also related to the occurrence of depression. Neurotransmitters such as serotonin, dopamine, and norepinephrine play important roles in regulating mood and affective states, and abnormal levels of them may contribute to the development of depression. Psychosocial factors, stress, trauma, and negative life events have also been identified as important triggers of depression. Stress in life includes work stress, family relationship issues, money issues, etc. Traumatic experiences such as abuse, sexual assault, loss of intimate relationships, etc. can also have a profound psychological impact on the individual. In addition, negative life events such as job loss, bereavement, and divorce can increase the risk of depression. Individual psychological factors, individual personality traits, and ways of thinking may also be related to the occurrence of depression. Some personality traits, such as low self-esteem, perfectionist tendencies, and negative thinking styles, make it easier for individuals to interpret and respond negatively to negative events in their lives, thereby increasing the risk of depression. Environmental factors. Environmental factors may also play a role in the development of depression. Substance abuse, chronic diseases, seasonal changes, socioeconomic factors, etc. may increase the risk of depression. For example, seasonal affective disorder, SAD, a form of depression associated with seasonal changes, mainly in winter, is associated with reduced sun exposure and disturbances in the biological clock. Depression, while devastating, can be managed and relieved with a comprehensive approach to treatment. However, treating and managing depression is a complex and individualized process that takes into account the patient's symptoms, severity, and individual characteristics. Here are some common treatments and management approaches. First, medication is one of the common treatments for depression. Antidepressants, such as selective serotonin reuptake inhibitors, SSRIs, and tricyclic antidepressants, TCAs, are widely used to reduce depressive symptoms. These drugs work by adjusting the levels of neurotransmitters in the brain to improve mood and regulation mechanisms. However, each person responds differently to medications, so treatment effects need to be carefully evaluated and monitored, and adjusted and managed under the guidance of a physician. Secondly, psychotherapy is one of the important methods to treat depression. Psychotherapy, such as cognitive behavioral therapy, CBT, and insertion therapy, IPT, can help patients change negative thought patterns and behaviors and improve their ability to cope with stress and solve problems. Psychotherapy usually requires cooperation with experienced psychotherapists and regular individual or group talks and exchanges to achieve the purpose of treatment. In addition, self-management and lifestyle adjustments also play an important role in the treatment and management of depression. Individuals can support their own recovery by establishing healthy habits and engaging in positive self-care. This includes keeping a regular schedule, getting enough sleep, eating a balanced diet, getting enough physical activity, and avoiding drug and alcohol abuse. In addition, being socially active, seeking social support, and participating in meaningful activities can also help boost mood and build a support system. In addition to medication, psychotherapy, and self-management, some patients may require a more comprehensive approach to treatment. For example, electroconvulsive therapy, ECT, may be considered an effective treatment option for some severely depressed patients. ECT improves depressive symptoms by delivering an electrical current to the brain, causing brief seizures. However, ECT is usually reserved for patients who do not improve with other treatments or because of other serious conditions. Also, for some patients, a comprehensive treatment approach may include other complementary therapies such as art therapy, music therapy, exercise therapy, and meditation. These therapies can help patients relieve symptoms of depression and improve mental and emotional well-being through creative expression, physical activity, or introspection. Key to the treatment and management of depression is an individualized and comprehensive approach. Everyone's depression symptoms and needs are different, so working closely with a healthcare professional is needed to develop a treatment plan that is tailored to individual circumstances. The effects of treatment may take time and adjustments, and communication and cooperation between patient and therapist are critical. Then there is the fact that treating depression is not just about symptom relief, but also includes long-term management and preventive measures. Regular follow-up and review are important to monitor changes in symptoms and adjust treatment plans. In addition, establishing a healthy lifestyle, learning to cope with stress, seeking social support, and participating in mental health promotion activities are all important factors in maintaining mental health and preventing relapse. The selection and application of the methods explained above need to be determined according to the patient's symptoms, needs, and personal characteristics. Through collaboration with healthcare professionals and active self-involvement, patients can receive appropriate treatment and management, improve their chances of recovery, improve quality of life, and prevent relapse of depression. With a better understanding of depression, we can better appreciate the severity and impact of this mental health problem. Depression not only causes great suffering to the individual, but also negatively affects society as a whole. Therefore, it becomes critical to take mental health seriously and provide support. We've covered the definition, symptoms, diagnostic approach, and treatment options for depression. However, theoretical knowledge alone may not be sufficient to fully understand the true nature of the problem. Next, we will use some real-life examples to show the impact of depression on personal life and how to deal with this challenge. Case 1. Ms. Zhang's adolescent depression. Ms. Zhang is an adolescent girl. She began to become taciturn, lose interest in things, and symptoms such as sleep disorders and changes in appetite. She gradually distanced herself from friends and family and lost motivation in her studies and daily activities. Ms. Zhang's family finally noticed her emotional changes and sought professional help in time. Through psychotherapy and support, Ms. Zhang gradually regained a positive attitude and learned to cope with stress and emotional distress. Case 2. Depression caused by Mr. Li's work pressure. Mr. Li is a young man working in the financial industry. Due to the high pressure of work, he experienced prolonged anxiety and depression. He was exhausted, lost enthusiasm for work, and began to experience physical discomfort. Mr. Li sought help from his superiors and family in time, and began receiving psychological counseling and drug treatment. By gradually adjusting his workload, changing his mindset, and learning coping skills, Mr. Lee has successfully overcome his depression and restored his work-life balance. Case 3, Mrs. Wang's postpartum depression. Mrs. Wang is a mother of a newborn. After giving birth, she experienced depression, anxiety, and uncertainty about parenting. She felt powerless to cope with the demands of her new role, lost confidence in herself, and experienced symptoms such as sleep disturbances and changes in appetite. Mrs. Wang's family realized she might be suffering from postpartum depression and sought help from a doctor. With the guidance of doctors and the support of her family, Mrs. Wang received psychotherapy and drug treatment. She learned to manage her time reasonably, ask for help, and share her experience with other new mothers. She gradually got rid of postpartum depression and regained her confidence and joy as a mother. Case 4, Mr. Liu's elderly depression. Mr. Liu is a retiree who is over 60 years old. Since retiring, he has felt a loss of purpose and sense of existence. He experienced sadness, anxiety, and fear for the future. He became less and less communicative with others and often fell into self-reflection and negativity. Mr. Liu's family realized he might be suffering from geriatric depression and helped him seek professional support. Through psychotherapy, participating in social activities, and focusing on personal interests, Mr. Liu gradually regained his positive attitude and found the joy of life again. Through these cases, we can see the impact of depression on different populations and the importance of treatment. These cases also reflect how people with depression and their families can overcome this challenge through a positive attitude, seeking professional help, and receiving appropriate treatment. Only by working together can we better support our own mental health and that of others, and create a healthier, happier society. Although depression can be treated, the great pain caused by depression is unbearable for us. Therefore, we need to prevent depression at an early stage to avoid depression. So, how to prevent depression? The key to preventing depression is promoting mental health and building an active lifestyle. Here are some steps to prevent depression. Raise mental health awareness, enhance public awareness and understanding of mental health issues, and eliminate prejudice and discrimination against mental health issues. Educate individuals and society about mental health, and provide mental health knowledge and resources. Establish a healthy lifestyle, maintaining a regular work and rest schedule, getting enough sleep and moderate physical activity can help maintain mental health. Good eating habits and avoiding drug and alcohol abuse are also important factors in maintaining mental health. Learn to cope with stress. Positive coping with stress and problem-solving skills are critical to preventing depression. Learn effective coping strategies such as problem-solving, relaxation techniques, emotion regulation, and positive thinking patterns. Build a support system. Build strong relationships with family, friends, and social support networks to share and talk about your emotions and distress. A supportive and understanding social network can provide emotional support and help with difficult and stressful situations. Seek early intervention and treatment. If you experience early symptoms of depression, seeking professional intervention and treatment early is key. Early intervention can reduce the severity and duration of symptoms and prevent further deterioration of depression. In summary, depression is a common and serious mental health problem, but it can be treated, managed, and prevented. For individuals, understanding the symptoms and risk factors of depression and maintaining communication with family, friends, and medical professionals can help identify and deal with potential depression problems early. In addition, cultivating a positive attitude, seeking out activities that are fun and satisfying, and focusing on self-care and affirmation of self-worth can also help maintain mental health. This episode of the program, we have explained it here. What do you think about this? Welcome to leave a message to discuss with everyone. If you also like our channel, please subscribe to us.